everyone. My name is Nida Shahil, and today I am here with Rehan Tahir, who is Persivia's AI and ML engineering manager. So, today we are going to be talking about a very important topic, which is the role of human intelligence in healthcare and innovation. So, Mr. Tahir, you've worked at the intersection of AI, machine learning, and healthcare for nearly 2 decades. Before we dive in, can you share a bit about your journey and what drew you to this field?
Sure, Nida. Thank you for such an insightful question. So I think the first time I sort of realized the importance of technology in healthcare was I was working at Microsoft and I had to rush to a hospital for a personal reason, and and I was quickly attended by the doctors because they were able to look up my health records instantly, and that was in 1999 while I was in Redmond, Washington. And at that time, because I was working at Microsoft, and the systems they used were built by Microsoft, I realized how technology is changing and shaping areas in humanity beyond just office work. And that piqued my interest. Secondly, while I was in the US, I was working at EMC, which was a large data storage company. I won the first innovation prize for developing a healthcare cloud for the developing countries, particularly in Rwanda and Africa. And for that innovation prize, I was given funding to implement it by partners in the health at Harvard University. And we implemented that first AI cloud, a healthcare cloud, in 2005 in Rwanda. They make a transformational change in the healthcare in Rwanda and emerging Africa. Um, and while I went to MIT, MIT being an engineering school has turned more into a medical school, and there's a lot of funding and research going on in AI and solving healthcare problems using AI. We started a startup in health at MIT called Health at Scale, which was a very successful startup. And I ran it for almost a decade. We solved very important problems in insurance and fraud, in healthcare and care navigation as well. So this is sort of my background. Currently, I'm working on two tracks, one in private sector, which is with Persivia, where I'm heading the AI side of healthcare. And I'm doing pro bono work with the government of Pakistan as an advisor to develop the healthcare technology stack for the Pakistan Digital Authority. So, so, so I'm sort of naturally, I'm trying to solve the important problems uh, as it pertains to humanity, particularly in health, using technology.
Wow, sir, that's really impressive. So, we hear a lot about AI in healthcare, but less about the human side. From your experience, how do you define the human intelligence in the context of healthcare innovation?
Right. So, so healthcare innovation, particularly in AI and assisting the healthcare providers and performing their work doesn't really mean that they're taking away work or critical work from them, but they are more of enabling them. I'll take the example of my brother, who is the head of the emergency department at Cleveland Clinic in the US. So he mentioned that that many times you are overwhelmed in emergency room in a fraction of an hour or half hour, or the critical cases, and the ER doctors are overwhelmed because you don't have a control of what type of patients are walking into the emergency room. So they resort to using technology, particularly as simple technology as YouTube and searching in YouTube how to perform the procedure. Um, that is very linear education to doctors. If imagine where you have uh, generative AI enabled agents helping doctors on critical matters, because human physiology is very, very complex. You have cardiologists, you have pulmonologists, you have radiologists, but what technology helps you is you have these thousands of biomarkers now, and you can correlate the interactions between the systems, between the human systems, between cardiology and pulmonology that a single doctor cannot do. And you can do it very quickly in a fraction of a time that is humanly impossible. So those use cases where the healthcare practitioners are incapable of addressing to because of their human capacity, technology can really help them and assisting them, and that will expand the horizon of care for the practitioners.
Thank you, sir, for answering this. So, where do you see the human intelligence complementing AI rather than, competing with it?
So, like I mentioned, one so that there's an immediate, there's a medium term, and long term. There are three phases where AI is going to help uh, healthcare. One, the immediate phase, a lot of the grunt work, a lot of the administrative work, which is the cause of burnout for the healthcare practitioners, will be taken away from them, and you'll have these autonomous agents doing all the clerical work, and that is great because the nurses and the doctors will have more face time and will be more emotionally available and for their patients, as well as they will be more focused in their care for the patient. So hence the technology is enabling them. And medium term, you will see new uh, diagnosis being done, new drugs being innovated, new procedures being innovated, because AI and big data is giving a new dimension to care providers in understanding the human physiology. And enabled by technology, they will be able to solve the important diseases like cancer in new ways, which was not done before. Autonomous care, like precision robotic surgeries and virtual hospitals, which are better than humans. And that doesn't really mean we are replacing humans. It's just that the enormity of providing good quality care, healthcare at scale, particularly at low cost, will be so much. So you will have to rely on technology to do that. Again, you are enabling the humans to solve the healthcare problem.
Thank you, sir. So, linking your answer to this, but do you think that when people worry about that AI is going to depersonalize care, that is, a false statement, and that how can, organizations ensure that quality enhances rather than diminishes the human experience?
Right. So I think, like anything in technology innovation, there's a it has to be done in a careful manner. So the technology is being used appropriately, and that's true for AI in healthcare as well. We have to go extra step in creating systems, AI systems that are uh, cognizant of the fact of human psychology, and they empathize with humans, and also they are assisting the practitioners, the healthcare practitioners in the right way. So the practitioners have more time to empathize with the humans. So the complete package it gives us significant improvement in terms of empathy towards patients, in terms of care, in terms of bedside manners, in terms of communication to patients. But that is not given, and that needs to be built into the product. And that's what we do at Persivia. We just don't create products. We, spend significant amount of R&D in making sure that those products work with the workflows that are existing in the hospitals, and the workflows don't disrupt the empathy to the in the entire caregiving process. I think the empathy is sort of built into the organically, so it's not that it bolt it on to the products that we create. So it starts actually in our backyard. So in our work culture, in our teams, we practice empathy as in our relationships with each other, as coworkers, as our superiors, with my team as well. So it's a shared value in how we relate with the world. Now that permeates in what we do as a machine learning team, and it permeates into the products, and it permeates into how we discover the products, the use cases, the user interfaces. So what I'm trying to emphasize on, so it's not an afterthought that, okay, now phase one is the product development, now bolt on empathy to it, but it's something that we stick to as a value in life, in our work, in our ethics, and and that automatically comes into the things that we create.
Thank you so much, sir, for answering this. So, looking ahead, what innovations in healthcare excite you the most when it comes to blending AI with human intelligence?
I think the in so human body is very complex. It's a dynamic system. There are thousands, hundreds of thousands of micro subsystems. I'm not a doctor myself, but and now we have the technology available where we can understand the interactions of those subsystems, uh, and it can really, what we call in engineering called system dynamics. So we can learn from human body using AI the true system dynamics of human body, and that has huge repercussions. That has repercussions of integrative health. So things like how your gut is related to your mind, or your how you age, how can you age well. So I think that is a wonderful new area where technology is going to unlock a lot of unresolved mysteries about human life. So, for example, in the machine learning portfolio, we are wrapping up pretty quickly on covering a lot of use cases and creating a truly digital health platform. So we are, like I mentioned, taking a tiered approach. In the tier one, we are looking towards the low-hanging fruit, where AI can help solve problems. So the approach we are taking is, we have to solve real problems, and that are uh, can be turned into real products that customers can pay for, and they are valuable for the customers. So in the phase one of it, so we are aggressively working towards eliminating the administrative workflows in the entire healthcare system, and we're creating an autonomous agent that will sort of assist the entire healthcare system. And we are taking it to a system level approach, and we're taking creating an end-to-end systems where will that will remove all the grunt work from the healthcare system, or what you call in engineering, or in Japanese language, Buddha from the system. So that is immediate sort of a product roadmap. And medium term to long term, we are going to more on helping in the diagnosis of diseases, and we are taking much more riskier bets in terms of resolving critical issues in healthcare using AI.
Thank you, sir. So, wrapping it up, I wanted to talk about your experience at GHE since you've recently been there, and what were some of the innovations that you saw that really inspired you, or for any healthcare leaders that are listening, what advice would you give them on creating a culture that embraces AI while keeping the human experiences intact?
Yeah. So GHI was an amazing experience for me at a personal level because I grew up in Saudi Arabia. It was a homecoming for me. And after a couple of decades going back to Riyadh, the energy I saw there by young Saudis, and the resolve to solve a very critical issue of healthcare, and the laser sharp focus on 2030 goals of healthcare by the entire nation was amazing. I haven't observed that, and the will to do anything to attain those goals. So that is sort of very heartwarming and exemplary. And I think what I saw in GHE was is reimagining healthcare in a very conservative manner, where they are learning from the best practices of the world, particularly from the US. in value-based care and adopting what worked there in a very careful and strategic manner. As a Persivia employee, it was a great thing to be there because Persivia has a 20 years of experience in providing eh, uh, some of the best products in measuring quality and cost and value-based care that thousands of practitioners are using in the US. So for engineer, the dream is to have the best tool for the very complicated unresolved problem and resolve it. So for me, it was like a kid in a candy shop. I had the best tool that's out available there, which is Persevere product in value-based care. And there's a very significant problem, which is the transition to value-based care for a very young
Hmm.
population in 2030. And it was amazing to be there from that point of view.
Great. Thank you so much, sir. It has been a pleasure speaking with you, and your expertise in the role of human intelligence, AI in general, is amazing to hear.
Well, absolutely a player, and thank you for such thought-provoking questions, and hope to have such discussions in the future as well.
Yes, sir. We definitely will. Thank you so much.
Thank you.